practice speech on surgery in space. Okay. With the space war and getting us to space, the age-old question has been, if there was a medical emergency in space, what would you do? And I'm going to answer that question for you today, and that is with the zero-gravity surgical technology that we have at our disposal today. We're going to talk about the aqueous emergent surgical system and how it works, why it's needed, is it safe for humans, and does it have any applications outside of being in space. The aqueous emergent surgical system was developed by the University of Louisville in Kentucky and by George Panatos. It partnered with Carnegie Mellon University under James Anataki, Jennifer Hayden, and James Burris. And it did have some assistance by the Budapest University of Technology of Economics in Hungary, and that was by Thomas Hager. The aqueous emergent surgical system, and that's the AISS, it is actually a transparent box that's air and water tight, and it has different designs so that it can fit different surgical sites. Once it's filled with a solution or with air, it maintains a constant pressure. This minimizes blood loss and also makes it where you can see what you're doing inside the dome or the box. It recycles the blood through a pump, and it also there's a robot that can fit on top of it that allows telesurgery to be performed from Earth into space. Like I said, the AISS is placed over the surgical site. It's then filled with a solution, and that ensures visibility so that you can see what you need to do. It also minimizes blood loss because if you put pressure on a site, it naturally has less blood loss than it does not. And there's no immediate danger of being contaminated because it is air or water tight. It does maintain constant pressure, and then the airtight holes is what allow it's almost like the endoscopic surgery where you're working through small holes. President Barack Obama, and this is why the question got reintroduced of surgery in space. President Barack Obama announced NASA's new goals, and that was to reach an asteroid by 2025 and to walk on Mars by 2035. This makes astronauts faced with a longer mission tours and increasing the odds of straightforward medical procedures in space, along with trauma, and just regular routine medical emergencies such as heart attacks or gallbladder attacks or anything like that. The AISS is still in the testing phases, and it's being tested on NASA's zero-gravity aircraft here on Earth, and that's called the Vomit Comet. The C9 allows brief moments of 25 to 30 seconds of zero gravity. They had 4 flights, 2 were simulated on the hearts of pigs, and 2 were actually artificial coronary systems filled with synthetic blood so that they got the full effect of what surgery would be like in space. The AISS has down-to-earth applications as well. It creates a sterile field for combat zones, which the number one risk of combat injuries is infection due to increased pathogens and bacteria. It also eliminates excessive blood loss due to the constant pressure feature on the device. And it lessens the strain on the blood banks due to the siphoning and recycling feature in the system itself. It also has applications in third world countries. Surgery in Haiti and these other places that don't have a lot of technology or the resources by doctors was just as impossible as surgery in space at one time. But due to the telesurgery, we can actually have someone here in the United States perform surgery on someone in Haiti using the telesurgery option on the AISS. It creates an instant sterile field, and it also recycles the patient's own blood, because a lot of these countries do not have blood banks. And then more complicated procedures here in the United States, such as brain and spinal cord operations, the lack of visibility when you're working, it has devastating consequences because you're working in minute, and this actually will help with visibility in that. So the AISS is a transparent box with a constant pressure feature, and it allows visibility, and it allows you to do surgery in space. And it works by filling full of solution and then having a robot or endoscopic procedures through the airtight holes. It's currently being tested, but it does have the promise of having applications down here on Earth, whether you're in space or whether you're not. And do we have any questions? Awesome. Cool. Practice speech done.